session 4. It's a guided advocacy panel. I will be moderating it. And I think we've, in the last couple of sessions in our clinical trial session, we've uncovered some of the issues that we're up against. And so hopefully through this panel, we'll equip the audience and we'll talk about some of the different strategies that these amazing advocates have used in the fight for access. And so, yeah, I'm just going to do a quick introduction and then we'll go into this. So, we have Mohammed. He is a passionate advocate for rare cancer treatment accessibility. He was inspired by his sister's battle with cholangiocarcinoma and fight for pemigatinib. He's committed to ensuring equitable access to and is a champion for patients' rights, striving to remove financial barriers to essential care. And we also have Brenda Clayton. She's the founder of the Cholangiocarcinoma Canada. And she is a retired registered nurse with a master's in nursing, experience in psychiatry, postpartum, and neurology. But after losing her daughter, Rebecca, to cholangiocarcinoma, Brenda's family founded Cholangiocarcinoma Canada, and to continue the fight for patients across Canada. Beside her, we have Melinda Bachini. She is the Chief Patient Officer of the Cholangiocarcinoma Foundation, and she's also a 15-year cholangiocarcinoma survivor. And advocating for patients all over the world. She served on national committees, including the NCAI Hepatobiliary Task Force and the NCCN Hepatobiliary Guideline Panel, advancing research in patient care. And at the very end, we have Cynthia Mitchell. And we all heard talk, but for those who might just be joining online fresh, she was diagnosed in 2021 with cholangiocarcinoma. She's a fierce advocate and community builder dedicated to uniting individuals affected by cholangiocarcinoma through collaborative initiatives. She works tirelessly to increase access to equitable and effective care across Canada. Let's just give a round of applause for them. So through this session, we have some pre-planned questions, and then at the end, we'll open it up for audience questions. So in this first topic, the what, why, and how of advocacy, if you guys can come up to the mic and then explain what advocacy means to you, and also how did you get started with advocacy? And yeah, we'll start with Mom. Oh, Mom, you want to just come up here? Oh, still ready? From here? Yeah. Yeah, you can press yourself. Sure. Okay.
Well, what does advocacy mean to me? I think it means, recognizing there's a gap in the system and, raising awareness through various channels. For me personally, when we found out that my sister chemotherapy was not working, but there was last hope, which was, have access to get access to pemigatinib. That was the only last hope that we can aim for. Then we recognized that it was not funded and she will not be able to kind of use that drug. So how we went about to be able to do that is, it's raise awareness through different channels, whether it was starting a change.org, petitions, then raising a GoFundMe account, then reaching out to the various news channels, literally going to their website, putting an email saying that, this is the story, this is what we need. That and also reaching out to my various, MPs from different legislations. Just simply it's making awareness to various people and knowing that there is a need for them and how can we achieve that need, work together to be able to, give hope to that person, especially for a dying person. They rely on, hope. As a person, who can is breathing, standing in good health, can only help that person amplify their hope is by doing what you can, is having a voice to give that voice to the voiceless people. And that's, for me, that's what simply means. And yeah, it's also relentlessly pushing for policy to change, because at the end of the day, especially there's a lot of medical experts, for example, Dr. Jennifer, Rebecca, and even the oncologist, Dr. Andrea, they know that there is a need for this drug. It will help, But we need to obviously let the politician as well as the policymakers know that there is a need for this, and these are the experts that are saying that there's a need for them. Let's work towards, changing that policy. Yeah, that's it for me.
We have 3 minutes, so. Well, anyways, so thank you very much for C3 for inviting me to speak today and for coming. And it's my from here. Okay, I just have paper just to make sure I can stay on target. Okay, so our story. So Cholangiocarcinoma Canada. We started our registered charity because our daughter Rebecca asked us to continue her fight so that nobody would have to go through what she did. Her story is on our website, which is mychcc.ca, so I'm not going to go through the story. It's sort of two-dimensional. So instead, I'd just like to tell you a little bit about Rebecca. So John and I lost a daughter. David, Sheila, and Teresa lost a sister, Rebecca, to cholangiocarcinoma on June the 30th, 2021. The photos I'm about to show you will reveal her character and demonstrate that she's more than just a story and how much she meant to us. So Rebecca was a registered dietitian. The second one there is spelling bee. It's not just the bumblebee. So she was a registered dietitian at the Foothills Medical Center in Calgary. She looked after some of the sickest patients in the hospital, and she loved dietetics. She was the chair of the Canadian Dietetics Education Committee in Calgary. But not only did she work hard, she wanted to bring joy into the lives of her patients. And so you can see that she did. So I know she's amazing. On special occasions, she would dress up and bring treats to all the patients and staff on her units. Because she was a registered dietitian, she knew what the patients could eat and what they couldn't eat. And the staff enjoyed the fun and creative side of Rebecca and told me that they looked forward to seeing what she would wear each time. That's Iron Chef, by the way. After she passed away, our others began to dress up for some of these occasions, and they shared their photos with us. Although an introverted person, she was a mighty mouse in our home, and she left a positive impact on everybody that she met. This is the last photo taken of the 6 of us. This is when we knew that Rebecca would not be able to attend her sister Teresa's wedding the following year. So we arranged for family photos to be taken. It was essential to Rebecca that we had these photos done. They were taken 2.5 weeks before she died. She's actually quite sick, and we treasure them. She also left, because her sister was getting married the following year, she actually left a recording, and we played it on Teresa's wedding, and there wasn't a dry eye in the house. It was quite emotional. So what is advocacy to me? So an advocate stands up for the people that they represent, and they support them throughout the entire process, from diagnosis along the continuum to treatment and beyond, until hopefully a cure is found. They support them through the patient support groups where they have a chance to speak with others that have the same diagnosis so that they don't feel alone. They receive a patient care kit with a note of hope and a message that they are cared about. The CCF started these, and they're very excellent. Newsletters, webinars, other educational resources, a mentorship program, and Myanmar back there is starting the mentorship program for cholangiocarcinoma Canada. In-person meetup events, Cynthia has had them for quite some time in Winnipeg, and recently one of the patients in Calgary asked if we could meet up. And so we met up 2 weeks ago for the first time, and we talked nonstop for over 90 minutes. And the reason we had to stop at 90 minutes is because the free parking was over. So we will continue it next month. Anyways, and who can advocate? Anybody can advocate for the patients. I believe that working collaboratively benefits both the patients and the cholangiocarcinoma community. It provides patients with a collectively stronger voice and the presence in their communities, provinces, and at the national level. Their voice must be heard. We talk more about this when we discuss pemigatinib.
Yes.
Thanks. How are we doing? No.
I thought you switched them around. Never mind. Hi, everyone. I'm Melinda Bachini. And by the way, I just want you all to know I am from the 14th province of Canada. leaving it honorary. I did grow up 50 miles from the border, so I feel so close. Anyway, the reason I became an advocate is because, having this diagnosis is incredibly overwhelming, frightening, frustrating, and scary. And when I went through the clinical trial that I went through and had such a good response, it was important for me to find a way to pay it forward. I knew how fortunate and how grateful I was to be here. So I started volunteering with the Cholangiocarcinoma Foundation. And at the time, really all they were was a discussion board on the website where patients and caregivers would come together from all over the world and just share information and resources, just like we're all doing here today. They just wanted to connect and know what each other was doing and how to help each other. And so that's where I started. And then I was fortunate enough to be able to come on as a full-time employee about 7 or 8 years ago. And now I have the opportunity to serve on national panels with the NCI, with the NCCN, those guideline panels, to be the voice of patients from all over the world. Not just sharing my personal story, because we all have a personal story, which is very, very important for us to share. Like Brenda said, it makes a difference in the approval of the pemigatinib. It will make a difference, hopefully, for the research chaos that's going on in the US right now. And it was the first thing that got me involved to be a patient advocate, is sharing my story at the state capitol in Montana when my insurance wouldn't cover the standard of care so that I could participate in a clinical trial. I told my story, we got a law passed, and that was the first time I realized if you tell your story, it could make a difference. So never be afraid to share your story and your experience. And now, like I said, it's my job to be the voice of the community, and I get to serve in many different areas on research panels where I can help design protocols for clinical trials and bring the patient perspective to that design so that they're successful for us and for the research, that it will move forward. I get to serve with industry and make sure they know the difficulties patients face so that when they're designing trials and doing research, they can design the best drugs and the best trials to better suit our community. Yes, and I'm also very privileged to be an advocate on the C3 Collaborative. And I just got done with an ABC national interview in the other room as an advocate with Dr. Mohammed, who's pictured here, and is the reason I'm alive. The reason I'm alive is because there was funding at the National Cancer Institute that I could participate in a clinical trial. And I just got to share how important that is. And so hopefully nationally it will be viewed. But for me, it's come full circle to now be a patient advocate on the C3 Collaborative, where I started as a patient getting TIL therapy, and now I get to be an advocate, encouraging the research for TIL therapy moving forward. Thank you.
Want to come up here, or do you want to speak from your chair? Yeah.
I'll speak from my chair.
All right. You're fine.
I won't take too much time. I think for me, I felt thrust into the role of advocate. And it initially, similar to Melinda's story, it begins as a self-advocate. And then I had a strong desire once I was stable to serve. And so my journey into advocating for others really grew through that desire. Across all areas of my life, I really believe that there is a place to amplify voices, and that it's through collaborative efforts that we inspire change. And so that's what advocacy means to me. In terms of, my introduction to advocacy. But I think joining the C3 was instrumental, but sharing my story publicly as well. I realized as soon as I started sharing my story publicly in Manitoba, people started listening to me and they were interested in helping me and helping others. So I strongly encourage others to do that. And then I think one of the pieces for me that's been important in terms of advocacy is just creating that community across Canada. So my advocacy might not look the same as these very stellar advocates on the panel here, but mine is more a role of, I think, uniting people so that there is this collective voice of patients.
Yeah, you are a stellar advocate.
Oh, that's me.
So we'll go on to the next topic, and it's been said before, but I just want to officially announce that as of April 3rd, there was a positive draft recommendation for pemigatinib from Canada's drug agency. And these four individuals had such a big role in that. And so we're just going to go through a little bit of what they did and how we really got this this positive recommendation. But first, just to give some context, pemigatinib has had a pretty long history of a struggle in Canada for approval. It was approved by Health Canada, I think in 2021 or 2022, but it wasn't approved for the next step, which was from the Health Technology Assessment Agencies for funding. Even though it was approved for funding in the US, the EU, Japan, and Australia, other parts of the world. This drug is a very expensive drug. It's roughly $200,000 a year, so really inaccessible for the majority of Canadians. So there was a lot of advocacy following that Health Canada approval and then the first rejection from the CDA and ENES. And that led to this first approval by ENES, which is the Quebec Health Technology Agency. And that approval came in November 2023. So since November 2023 and onward, I think that's when the C3 became an organization, same with CHCC. We really joined forces and started this flurry of advocacy activity, which we'll highlight in the next coming slides. So questions for the panel, and please just share the mic. But what was your involvement in the efforts leading up to the resubmission and now a positive recommendation? And then also, what did you learn from the process?
No slides on that?
Yeah, I got slides. I'll switch them. You want to go first, Mohammed?
Sure. Yeah.
Yeah, it's on.
For me, as I mentioned that when myself, my entrepreneur, and my family realized that there's a drug for it, but it's not funded. How can we get funded, or how can we get access to it? This is when I've taken this step first, to make it aware to people to the audience that how can we make awareness for this drug. First thing I did was I opened a change.org petition just to amplify the awareness, along with GoFundMe account, so that we have some funds for her to be able to access that drug while we find either temporary or permanent solution to be able to get this drug. Then I reached out to CTV News to get some coverage. Then Yahoo Canada to also get coverage from them. Then I had also reached out to my local MPs and MTPs for them to be aware of the situation, the nature of importance. Then luckily through, I think I would say luck or, good deeds, that our MP Mike Morris was able to raise this with the federal health minister, importance of this issues. Then later on, the MPP was also raised to Health Canada. Also, along with that, I've also followed up with some of the health minister email chain, which was started by Dr. Jennifer and other members. I relentlessly followed up just to get a response for them. Letting them know that time is an essence. Not my sister as well as other patients don't have the time to wait around, get a response for them. I relentlessly followed up to make sure that we are seeing, we are hearing news or getting update from the various policymakers to ensure that this drug is funded. And through that, I think just a month or maybe a couple of weeks before my sister passed away, we got the good news that there is a assistance program which will allow to get access to this drug until certain time, which was, I believe, up until March. And which that was a good outcome of some of the work that we've all done collectively. I don't want to take any credit, but collectively, us as well as some of the people that supported us through whether it's sharing our change.org petition or sharing our stories and all of that helped allowed to do a resubmission which Brenda organized a resubmission document files, which good outcome out of that.
Yeah, it was hard.
Yeah.
Okay, so Neil Maher got a hold of me at the beginning of January last year, and he said, there's 2 patients in Alberta that need pemigatinib, and I went, no, I didn't. So that started my role. So I got a hold of them. I got a hold of the medical advisory board members. I got a hold of Insight and the patient support program because I needed to know more about it. And so I was learning more and more. And then I was trying to figure out who could I call that would give me more of a direction. So I had a friend who was a former MLA in Alberta. So I called him to find out, okay, what can I do here to get this heard, and how can I get a hold of the health minister? We had a quite a long talk, and actually his daughter had gone to school with Rebecca, so it was nice. There was a connection there. So then I also had a strategist that I talked to. And then I wrote lots of letters, like many letters, and also contacted the different news media. And I'm not sure how, I just bombarded Alberta with letters. So that's probably why the Alberta Health Minister said she wanted to have a meeting with me. So that was set for Alberta 2nd. And then when I met with her, and before that, we had a CTV News article done with Chris. That was March the 24th or something. And so then when I met with her on April the 2nd, she hadn't seen that news article. So I sent her the link and she watched it. We talked, I had a half an hour appointment with her, but we talked for an hour. I gave her all the information from Insight and also Dr. Ravi Ramji Singh's article that he'd written on best practices for cholangiocarcinoma. And I highlighted all the things. So standard of care, then when that's finished, then if you have an FGFR2 fusion, pemigatinib, right? So highlighted all that. And she took it all and she read it all. And so when we went, that was April 2nd, and I made an appointment with her again in May. But in the meantime, we went down to Salt Lake City, and there I got a call from, so it's 2 weeks later, from Sandra Reese from HS Pharmacy Services. I can't remember her exact title. And she wanted to know, I mentioned 2 patients' names. She wanted to know Jennifer's phone number, so I gave it to her. And then I said, well, do you want Chris's number? And she said, oh no, I phoned him and I left a message, but I haven't heard back. And I said, oh, well, he's here with me in Salt Lake City. So she said, can you just tell him to call me back? So she did. So I did. And he came wandering over while we were talking and said to me, he had this sort of Cheshire cat grin, and said, I got covered. He said, what? You got covered? So that was really neat. And then, but we weren't sure what to do or where to go. So then Jennifer emailed me and said she got covered too. So then I met with Adriana LaGrange, the Honorable Adriana LaGrange, sorry, in May, and it was difficult for her to cover it, but she did because, right, she was going against Catholics, she was going against everything else. But she read all the literature and she said, I don't know why they're not covering this. So she did, but we didn't announce it because she would have gotten probably into a lot more hot water than she did. So it wasn't until June. I kept waiting for the announcement, didn't hear it. So in June, Alicia, who'd done the CTV News article with Chris, got a hold of me, and so we redid one. And at that point, she called the government and found out that it was going to be covered on a case-by-case basis. So that was the first time we heard it was in June, so it was really exciting. And then after that, the C3 and 8 other organizations, I think there they are. We got together and we wrote letters, and we got together and wrote this letter, but we didn't actually submit it to the Honorable Sylvia Jones until September. And then Leonard and I revised and sent it out to the other health ministers. And then we heard that they were going to do the HTA submission in October. And so that was kind of exciting for us. And I was actually it was very exciting for me because I got to talk to Nora because she was one of the ones who we interviewed for the pemigatinib. So anyways, we did interviews, and CCRAN helped a lot, Philomena's group, if any of you know her. And we interviewed 12 patients, and 6 were from Ontario, 4 from Alberta, 2 from BC, and all but 3 of them were on pemigatinib. So we were really excited about that, and just we're hoping and praying that they would pass it. Anyways, that's my story.
I'll just make another comment. Like, this interview process was such a big lift. All of those interviews were 1 hour to 2 hours, and Brenda put all of it together, and then we submitted it together to CDA, and I'm almost like for sure that would played a huge role in the positive decision. So yeah.
Well, I'm gonna say, we definitely signed on to the letter, but boy, this started a long time ago, right? And I just have to say, 3 years ago, was not a C3, there was not a CHCC. And I am so thrilled that now Canada has 2 advocacy organizations advocating on behalf of cholangiocarcinoma patients. Because when it was first put in for submission, we were coming from the US and I was gathering patients, I was writing letters, I was doing whatever we could for that first time go around. I remember how defeated I felt. Can't even imagine how the patients would have felt here when it wasn't past the first go around. I had no idea what I was doing in a Canadian health system, but I wanted to help because the patients were reaching out to us at the Cholangiocarcinoma Foundation, and they were seeing patients getting access to these drugs and wanted to know why they couldn't. And boy, that breaks my heart. So I couldn't be more happier to have been a little bit of it in way back in the beginning. And I'm so happy again that there are 2 groups advocating for research and patient support in Canada now. You guys, it'll be so much easier because it was hard to find patients back then, and now look at a room full, which is not a good thing, but I'm glad you're back
So my involvement with this particular initiative was more in along the lines of sharing through social media. I don't have a large following or anything. I'm definitely not, like an influencer. But I definitely like to share, and I feel like the people who listen to me are pretty good listeners. So, but I was able to share about sorry, I'm losing my train of thought here. The call for patients. One other thing that's great about being a patient is that you get to know all the patients. So I made sure I went through my digital Rolodex of anyone that I knew that had the FGFR fusion, that had been on pemigatinib or needed to be on pemigatinib, that I connected with them to make sure that they had reached out to both C3 and CHCC. And then, it was just a matter of resharing posts and making sure that it was as visible as possible.
Yeah, another person who's not represented on the panel are the great physicians that also helped advocate for pemigatinib. There was a whole physician feedback form similar to the patient one, and that was headed off by I think Vincent Tam, but also Jennifer Knox and many of the people in this room. So it really took a collaborative effort, and I think everyone contributed their own unique talents. Myself just organizing and coordinating things, and here we are today. So this can all be found on the website. I'm going to just skip through this slide. There is a draft recommendation already that's posted. Everyone can read it. They have a table 1, some conditions and reasons. And I believe that the next step is to provide feedback on this draft recommendation. And I've already seen the email threads from the physician side. So they're already coordinating together. And I think that very soon we will close this book and then start the next challenge. Also, again, Insight had played a big role in this too, and there are some Insight representatives, Taylor and Heather, and so thank you again for just sticking with us. Okay, so at this point, we'll just lead into the group question, but we'll start off with these 2, and then if you do have questions, feel free to line up at the podium. But this is more just about looking ahead. How do we ensure that these advocacy efforts will lead to lasting change? And also, how can the people today listening help advocate for cholangiocarcinoma? So just let the panelists fight over the mic.
We're doing that. So I think the most impactful advocacy strategy that we used was a combination of things. So finding out what the patients needed. I had to write this down so I wouldn't forget. Contacting the physicians, contacting the drug companies, keeping the pressure on through letter writing, joining with other organizations to write to different politicians and news media. But I think probably the most difficult one and probably the most impactful one was trying to get an appointment with the health minister to make a change. I think that was the big one. And I learned that when you write the health ministers, they don't always see your letters. Their staff write the answers. So, I mean, they had no clue. The Honorable Adriana Green, I'm calling. She had no clue that Cynthia had written her, that other people in Alberta had written her because she hadn't read those letters. So I think that was very interesting for me to hear. So I think bombarding them with letters, and not form letters. They can pick out form letters. I learned that from my friend who is the former MLA. Don't do form letters. You can do a similar letter to somebody else, but don't do a form letter. That was his advice to me. So, but I want to say it was a team effort. I mean, we couldn't have done this without everybody, almost everybody in this room. So, thank you.
For me, I think, it's continue to have a voice, that's the most important thing, because we would see, when we start something, we would see some light, but that doesn't mean that we stop, that light. We need to continue to, find ways and opportunity to see what we can do, because ultimately there would be, other people or other scenarios where that needs to change. We need to have that voice and help the voiceless, give a voice and continue the momentum until, we see changes, and the changes have to be better. We shouldn't be in a position where that there is a system gap. We feel that system gap, but there's also other system gaps that we also need to realize and recognize it, and then take action for those ones, because that's going to ultimately help keep an everlasting effort.
Yeah, I just say continue sharing your stories and telling your stories, especially the results of of what this approval did. Write them back and say, because of this is where I'm at, and continue that effort so that it'll help advance the next effort faster.
I've already spoken to Survey about Advocacy and putting their HTA submission in.
Are there any questions from the audience? We can open it up to that. Actually, this is yeah, if you can also just start lining up at the podium for the next ones.
Another naive question. I've been retired now for almost closing on 20 years, but so back 20 years ago when I was somebody,
You're still someone. You're still someone.
I used to be with Treasury Board, and when budget time rolled around with the federal government, it was very interesting to see how the federal departments participate in budget making. Many of you perhaps know, but departments have no clue whether they're going to get money through the budget process. They all submit ideas for the budget, but only the finance department knows what's going to appear in the budget. When the budget comes out, this pandemonium breaks out as we all scrabble to figure out what was announced in the budget that would affect individual departments. What we learned through that process was the finance department would always have a base budget of money that it would have to allocate to individual departments. But then at the last minute, they were looking for the little packages that they could tack on to go into the budget speech. So they were looking for lovely, neat initiatives. And as I listen today, it strikes me that we don't need an initiative on pemigatinib or this or that. It certainly sounds like Canada could use a lovely, rosy initiative called Rare Cancers. It would have multiple dimensions to it, like better testing, faster approvals, models for conducting clinical trials. So while we can continue to advocate for individual pharmaceuticals or individual surgical techniques or whatever, what we really need to do is build a lovely, attractive package that one or more political parties could adopt and take as its plum to the budget making process. But because that's the only real way that you're going to affect the kind of fundamental changes I think rare cancers deserve. It strikes me it might be worth keeping. Now, I may have just said what was patently obvious to Dr. Knox or whatever. They've probably been pursuing this for many years, but it strikes me that building of an initiative, multidimensional, is something that a bunch of citizens could participate in, not just specialists.
You're hired.
Absolutely.
You're hired.
Yeah, hi, just a couple of things. Leonard, you mentioned the idea that you sent the message out to all the health ministries after it got approved. So is that to each province? Does the health minister to each province?
After we sent it to Sylvia, you mean?
Yeah, after,
Yeah, we sent it to all the provinces, so we revised the letter. You're talking about after we sent it out to Sylvia? Yeah, we revised it and sent it out to all the health ministers in the provinces and territories, yeah.
okay, that's good for me to know this, my next steps. And the other thing too is I've seen the CTV interviews. Will we have a copy of the CBS one that Melinda just did?
ABC, and as soon as I get the information for it will be aired, I will happily share it widely.
Thank you.
I think from my side, I think there will be a CTV News and Yahoo follow-up article they come out regarding the good news that we got. So that will be available at Brenda's website as well as the C3 website.
And that will be Ontario, because I know Alicia's already said to me, when we find out, I want to do a news article, so.
Yeah, there's a lot of avenues, and on our website, if you go to the news section, we try to post all of the latest things related to cholangiocarcinoma, so you can find it there too.
I'm just going to share a couple of things that I learned during this process. One is like having a little sound bite. I mean, we see this with Donald Trump too, right? The sound bite, just that little one sentence that, so ours for C3 has been research is care. And what I think is so striking to me is when I talk to senators and politicians and explain what this means, they have no line of sight on this. If they haven't had a loved one or themselves go through a cancer diagnosis, they really don't understand what that means. And they think of research as something that's done at universities and 20 years later would impact care. They don't realize how quickly this is transforming our landscape and how quickly Canada is falling behind. So having those little sound bites, whether it's things like, why would we invest so much in health research if we have no intention of providing patients with the drugs that they need at the time when they need them the most? Things that really resonate with people. The other thing that became obvious during this advocacy effort is that other than Alberta, and who wanted to keep it quiet, right? Everyone else was not willing to go against CDA. And so what they needed, and I'll say this sort of trepidatiously, but they needed a way out. They needed us to go and tell them that they had to go through another review process. I think and I think Jennifer said this before, like they made a mistake and they needed a way to not admit they made a mistake, but change the decision or something. So I don't know if there's lessons learned there. Maybe hopefully the next time around they'll be cognizant of that and maybe take more time to make sure that mistake isn't made. But that became obvious through the process that advocating at the provincial level wasn't as effective as we thought it would be. It was about going back to the whole process, changing decision.
I do think they got some pressure from the province to go back and invite them to review. So I think it all worked slowly.
Yeah. Thanks.
Okay. Just wondering if there's any questions from virtual.
Yes, so one's just a comment. Bravo. One of the previous presenters also mentioned that there is a rare cancer niche that would be a perfect match for Canada to slip into. And the other question was, what can we do or how can we push out a health authority or cancer authority to see specialists who specialize in CCA? We are constantly paired with oncologists who are not GI oncologists or who have no idea how to treat CCA patients. Currently, we are constantly put down as patients or caregivers to ask for referrals. Oh, we're put down.
I know that's happened in BC because I've talked to some patients there, and there's actually nothing they can do about it. So what they do in BC though is they do present the patients at rounds, and so the physicians who deal with the CCA do actually see those patients. But it's very frustrating for them, really frustrating for them, because they don't feel they're cared about as much, right? And they probably know more about the cholangiocarcinoma than the physician looking after them.
I guess I'll speak to that as a patient. I understand that there are certain barriers, potential barriers. But I think that there are, I think Dr. Knox even explained, it's sometimes it's as simple as a referral. But honestly, and like I apologize to anyone in the room who doesn't want me to share this, but I reach out to physicians. I find their emails, I reach out to them, and sometimes they answer me and sometimes they don't, and that's okay. If they have time to answer me, they have time. If they don't, they don't. But sometimes that alone inspires my local team to have more of a willingness to collaborate with others outside of Manitoba. Because I've often said too, in settings where there's been some resistance from my local team in the past, I said, like, what would you do if if I was your wife, or if I was your daughter, or I was your sister or your friend? You would want to see someone who sees a high volume of cholangiocarcinoma patients. So please don't deny me that. And normally that line's pretty effective, even with the hardest of folks. But yeah, I think if you can't get an official referral, reach out. If people are genuinely there to help you.
Dr. Idrissa?
Yes, you probably read it, but I just want to echo this. My colleague got an email from someone who saw him on YouTube talking about cholangiocarcinomas, emailed him, said, I know that you guys have this panel. My physician would not send it to the panel. And we discussed among ourselves, organized spoke to the pathologist, organized the way to send the specimen to us. So I think it goes a long way to try, and if we can help, we will try to do that, most of us.
And I think it's a global issue. Patients become their own best advocates, and there's such urgency to find answers and help that we will turn over every rock we can.
Thanks. For me, one comment I want to make is always, if you have something or if you think you need to reach out to someone, don't be afraid. Just continue doing it. Especially for myself, I've reached out to multiple news channels, not expecting that they'll respond to me. But I have a due diligence to ensure that I tell myself that I've tried everything to get someone to listen to me. Sometimes it works, sometimes it doesn't, but then you can tell yourself that you've tried everything to help that person that you love, to make that awareness.
Well, and the worst thing that can happen is they say no.
Yeah.
So it's a different way of doing it this time.
Okay, I've got another question. Can I? Okay, Simona Dowling, who's up in BC, asks, are there any good news about other targeted drugs used in medical protocols for treating other cancers driven by gene mutations, like olaparib, a PARP inhibitor for targeting BRCA2? Why are they not approving quickly these drugs to treat cholangiocarcinoma?
I think that leads.
That's a good presentation.
Well, I'll maybe give closing thoughts and then, because it sort of relates to that, but really we have to think bigger in the way we advocate and the questions that we're asking. So yes, pemigatinib was one drug, but there are so many others, just like Simona mentioned. And we need to find a way to change it, maybe systemically or from the bottom up. And we're working on that. So there are ways that you can get involved with advocacy through the CCF, through CHCC, through the C3. We actually do a joint advocacy meeting every month where we discuss issues like this. It's open to everyone, patients, physicians, maybe not industry, but Yeah, at these meetings, we do them monthly and we just, we try to tackle these issues. And so hearing the different issues is one thing also. And then we'll figure it out. I think a common theme was that it's not easy. And so, but we're here and we're fighting this fight with y'all. So with that, maybe we'll close the session. Thank the panelists for their insights. So,
Tom, do you want to?
yeah, it's 3:10 right now.